So this is a podium that was presented at AUA 2024 in San Antonio. This is a literature approach that is proposed by our group, and it can be applied to different aspects of science and surgery, for example. And here we focus on erectile dysfunction. And I don't have disclosures related to this presentation. Erectile function after radical prostatectomy suffers from different challenges, or we have different aspects that we should consider. Measurement, standardization, and also the heterogeneous clinical scenario. The guidelines suggest that we use prompts because different aspects related to lack of external validation, uncontrolled application, and other aspects. So it's a real challenge to measure and quantify erectile function after radical prostatectomy, even if you do it through open, laparoscopic, or robotic assisted. And here we will see how literature has done this so far, and what should we do to improve what we have. So about evidence, this is what is known so far. So the iceberg of evidence. Here we see the aspects we have in the systematic review. Usually we have specific questions, the homogeneous population, specific scenario, high precision. However, it has a low representativeness. It's super specific that is hard to represent all the situations or all the aspects of the disease that is being studied. So we came with something called reverse systematic review to make broad questions, heterogeneous questions in a very varied clinical scenario that represents the real world, so we can get high representativeness. What we do is we just get the studies that fed the systematic reviews in a topic, and we make a big database, putting together all data, collecting data that from all manuscripts or original studies that fed all systematic reviews in a topic, and then we do a specific question. For example, coming back here, putting radical prostatectomy, open, laparoscopic, and robotic assisted, we had 268 studies, and that included 131,000 patients. And we saw that they had different criteria for erectile function, and then we further studied how it happened and how we can improve that. So what we found was that in all studies available, or the best evidence published so far, almost 80%, like 74% of studies use as a tool erection sufficient for intercourse, what we call ESI. The ESI, that is erection sufficient for intercourse, was utilized in most studies to evaluate erectile function. As you know, erectile sufficient for intercourse is subjective and less precise than, for example, validated questionnaires like SHIM, and a small number of groups or percentage of studies used like shin is more than below 21 or shin below 16. And some studies also use others methods to evaluate erectile function. So the best evidence so far is limited by the use of erection sufficient for intercourse. So this is a main aspect of the data. That means we rely on subjective information. And I'll show you also more aspects that are important. For example, when we get the global results utilizing all techniques to measure erectile function, we see different on the left side of the screen. We see different numbers or percentage of erectile function recovery during the period after surgery. So it's expected that the erectile function recovers during the month after surgery. And we see here the global result is 55% of erectile recover after 18 months of surgery. This is global for all techniques, all surgical techniques, and utilizing all tools to measure erectile function. On the right side of the screen, you have the same thing separated by surgical techniques: open, laparoscopic, or robotic assisted in blue, red, and green, respectively. So you can see that different techniques might offer different results. Okay, but when we look at this, separating or specifying which tool was used to measure erectile function, the results can be a little different. So here is when using different tools, and we see, I should move these a little bit to not cover the pictures. And for example, when we use other tools, robotic surgery can have really lower results or not as good results compared to other techniques like laparoscopic and even open surgery. So depending on which instrument we use, if we use the more utilized and subjective, the erection sufficient to intercourse, we see in green the robotic assisted surgery performance that is progressive and higher than other techniques in the literature so far. But when we use other ways of capturing the erectile function, lots of tools here are prompts, we do see different results, and sometimes not as good as we see when using other methods. So the method used to define erectile function can interfere in the results we get. So depending on the methods, we have better or worse results. So this is super important to be known when we will read the literature, and this is important for future studies to use more specific and precise tools to measure erectile function, so then we can have a more accurate understanding of, for example, in this case, erectile function after surgical treatment of prostate cancer by radical prostatectomy, even if we use open, robotic assisted, or laparoscopic approach. So here is the same thing, but how it can vary, the variation. So the variation can be like as high as negative 40% and also positive 20%. The erection sufficient for intercourse is the tool that has the lower variation, maybe because it's the most utilized. So 75% of studies used this method, although it's limited. And also because they are different ways or of measuring erectile function. So they have higher or lower variations. And this is important because here we see that the tool used to define or to measure erectile function can interfere in the results we get. In conclusion, prompts are little used in the studies chosen to be part of the best evidence, or the best evidence so far used in almost 80% of studies, erection sufficient for intercourse. Although this erectile sufficient for intercourse is a simple criterion and not naturally chosen by scientists so far, it should be consider that it's not that precise, comparing that is a subjective method. So future studies should use more precise tools, so then we can prevent low standards in science and also improve the quality of data and quality of evidence that we have so far. Thank you.